Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about management of fracture, treatment of fracture. First of all, what is a goal? Goal of fracture management is to restore the anatomical position back to its normal. Okay, in a proper position, proper form. Okay, what is a orthopedic surgeon? He must ensure that there is no physical disability in that area to the patient. Now, what is simple management of simple fractures? First of all, the management of fractures are broadly classified as simple, open and complicated. First one we will see simple fractures, conservative, operative. Conservative means it is for undisplaced fracture, incomplete fracture, impacted means undisplacement means the bone will break but it will not move its alignment. Inside only they will break but it will not move its alignment. It will be in that same alignment only. Not severe one will say. For that conservatively will give cuff and collar for upper limb, cuff and collar for upper limb, strapping for clavicle, ribs, and POP, plaster of Paris, for injured limb. Next, rest and NSAIDs, non-steroid anti-inflammatory drugs for impacted femur, neck, like that. Okay. In this, it is three major treatments, managements have to be considered. First one, resuscitation. This is it's a topmost priority. If the patient is in shock, it followed by fracture. A to F management, which is proposed by McMurthy. This is given in emergency situations like airway management, blood and fluid, central nervous system, digestive system, excretory and fracture management have to be done. A to F management. First one, this resuscitation have to be done. Next one, reduction means in this by giving general anesthesia, the closed reduction, continuous traction, open reduction have to be done. Closed reduction by this is the technique followed by traction and counter traction method. This is given by a proper skilled person and expertised person. So if it is not given by technique expertised person, they will see malunion is seen. Next one, continuous traction. This is given in gallows traction for fracture of shaft in children, and balanced skeleton traction for adult femur fracture only. This one in gallows traction, continuous. This one balanced skeleton traction. Next, open reduction. This is done by a surgeon when the above two methods fail. Okay. Now, what is the rehabilitation? Firstly, in rehabilitation, retention of the fragments to normal by plaster, cast or slab to restores the anatomy of the bones. Okay. Next the principle means what we have to keep in mind means to restore the function and movement of fractured bone, fractured limb, unaffected joint. Also we have to maintain exercise from losing the normal movement and function. Okay, we have to check both the limbs, affected and unaffected. Next one, rehabilitation protocol for plaster treatment during immobilization. During immobilization means not movement. Limb should be elevated, means not move. Here, mobilized joint must be after mobilization, elastic bandaging and limb elevation should be done. Now, active exercises for unaffected joint in immobilization. Active exercise for affected and unaffected joint in immobilization. Isometric for immobilized muscle, isometric and isokinetic for muscles in mobilization. Functional activities by unaffected limb immobilization. Encourage functional activities with affected limb. Crutch walking training in lower limb fractures. Here, gait training in lower limb fractures in mobilization. See, post-immobilization phase means to decrease pain, thermotherapy like ultrasound, TENS, SWD helps. Next here the fracture unites firmly. Isotonic exercises can be done. Next, to mobilize the joint. To mobilize the joint, active and active assisted exercises are to be done. To strengthen the muscles, progressive resisted exercises are done, and gait training in lower limb. Okay, these are to be done. So I hope you understood this topic. Thank you for watching this video, management of fracture.